morning. Welcome to our session this morning on medical device supply chain and sourcing, lasting impacts of COVID-19. My name is Jackie Butler, and I am the U.S. Director of Operations for BIOEPJ Paso-Juarez, and also the Senior Director of Operations for the Medical Center of the Americas Foundation in El Paso. I'm very excited to welcome you to this great panel discussion this morning and to introduce our moderator this morning as well. Before I do that, I wanted to take the opportunity to share with our audience a little bit about what BIOEPJ Paso-Juarez has been doing in response to COVID-19 over the last 10 months. As an industry association working with medical device manufacturers in El Paso and Juarez, we were really quickly thrust into conversations in late March, early April, and May about what the region was doing as a whole to respond to COVID-19, what the capacity levels were for local manufacturers to produce urgently needed PPE items, as well as ventilators and other kinds of medical devices. And so we mobilized very quickly to develop a COVID-19 response task force made up of manufacturers, suppliers, government officials, and local leadership organizations to really try to understand how the industry could contribute to local response efforts. We were able to share best practices, engage in regulatory policy discussions, provide input to government organizations when it came to business closures and maintaining medical device manufacturers as essential businesses to remain open. We were able to contribute to conversations with local leaders, with healthcare providers, medical systems about the capacity and capabilities in our region to provide more of these urgently needed items in response to PPE. We created resources for people to be able to source PPE items locally. We have posted on our website local manufacturers and suppliers of PPE items where people can go and see what's available. We've collaborated with community organizations such as the Better Business Bureau to make sure that they have reliable sources for these items as well. Over the summer, we applied for and won $400,000 of CARES Act funding through the City of El Paso's economic development response efforts to help any manufacturers, suppliers, service providers shift their efforts towards COVID-19 response. So any manufacturers or suppliers who had the capacity and the capability to shift production to face shields or face masks, we wanted to be able to give them the resources that they need in order to make that shift long-term, and that they're knowledgeable and informed of the regulatory issues surrounding medical devices that will enable long-term success in this area. We have had over 100 member meetings, lots of events, including this summit and trade show to help bring awareness to the industry and our ability to contribute to COVID-19 efforts. We know that supply chain was impacted drastically beginning early last year or early this year in 2020 because medical device supply chains are global and those disruptions were widespread. For today's session, we didn't want to rehash a lot of those supply chain issues that everybody is all too familiar with. And we know that our membership and our manufacturers in the region have been working tirelessly over the last almost 12 months to readjust and to respond to those issues. What we wanted to do today was try to look forward and understand a little bit more about how the healthcare industry is adjusting and the needs that they might have for medical device manufacturers and providers moving forward in response to COVID-19. So we're really happy to be able to bring to you some great speakers today. And I am not going to steal any of Jessica's thunder, but I would like to, before we begin, remind you that there will be a recording of today's session available on our event platform, and that there is an opportunity for Q&A from our great panelists. So if you could utilize the Q&A option in your Zoom windows, please feel free to do that throughout the session, and we'll have an opportunity to address your questions at the end of the discussion. Just another reminder to please visit the virtual trade show, the exhibit hall that we have, and interact with the attendees that are on the virtual platform. And now I'd really be remiss if I didn't thank the City of El Paso's Economic Development Department for all of their support of Paso-Juarez over the last 3 years that we've been up and running, and all of the support that Jessica and her staff have given to us as an organization. Jessica, let me pull up her bio. Jessica Herrera is the director of the City of El Paso Economic and International Development Department. She was born and raised in El Paso and earned her bachelor's degree in government from the University of Texas at Austin, her master's degree in business administration with a concentration in international business from the University of Texas at El Paso. Jessica has more than 15 years of economic development experience, including expertise in business recruitment, retention, and expansion efforts, small business development, real estate and retail recruitment strategies, and successful marketing and communication initiatives. As a director of the City of El Paso's Economic and International Development Department, she works to build and strengthen public-private partnerships to build key assets for the city and help create an environment that supports a vibrant regional economy. Once again, Jessica, thank you for all of your partnership and support of our organization and for being here with us today. I'll hand it off to you now.
Thank you so much, Jackie, and good morning, everyone. Thank you to all the panelists who have joined us in yesterday's start of the program with Paso-Juarez, and thank you for today's continuation of our summit and trade show. I'd really like to extend my appreciation and gratitude to Paso-Juarez and the Medical Center of the Americas for always really convening industry, government, nonprofit, and educational institutions. And it's really an opportunity, where passion and drive are there to improve consistently our region's global competitiveness and quality of healthcare for our region. So thank you very much, Paso-Juarez team and MCA as well for your partnership. Thank you to our panelists today, Nico Tejeda and Dr. Spier, for your time, participation, and continued support and service for our community's health and safety, especially during this time. We'd really like to thank you. And let me begin by introducing our panelists. First off, Dr. Spier is the president of Rio Grande Urology Group, and he is the managing partner of this urology group that extends along West Texas, Southern New Mexico, and Chihuahua. There are over 23 providers with 5 offices and 2 radiation centers that are employing over 200 people here across our region. The Rio Grande Urology Group is an independent medical and surgical practice with patient services to include urology, radiation, oncology, pathology, and in-house pharmacy. Dr. Spier graduated from the University of Texas branch in Galveston, Texas, where he also completed his urology residency training. He currently serves on the Large Urology Group Practice Association Board of Directors, and he has served on the board of the Texas Urological Society and is currently the Vice President and Secretary of the El Paso County Medical Society. Thank you, Dr. Spier, for your time today with us. Nico Tejeda is our Group CEO of the Hospitals of Providence. He has also, Hospitals of Providence includes over 60 access points in the community, including 4 acute healthcare hospitals and a children's hospital. In addition to his role as Group CEO, Nico serves as the Chief Executive Officer for the Hospitals of Providence Memorial Campus and Providence Children's Hospital. Prior to his current role, he served as the CEO of Texas Hospitals of Providence Trans Mountain Campus and the Texas Hospitals of Providence Sierra Campus and the East Campus as well. We'd also like to congratulate Nico. The American Health Association just recently awarded him with the 2020 Board of Trustees Award. And again, thank you for participating in today's session. Without further ado, I'd just like to give some context to everyone here in the audience. COVID-19 has disrupted global supply chains along the traditional healthcare delivery systems. This panel discussion will be welcoming leading hospital administrators and medical professionals from El Paso who will discuss how COVID-19 has impacted hospital and clinic level PPE supply and inventory management, how PPE and medical devices are changing healthcare delivery in the new COVID-19 environment, local, state, and federal policies that will impact local purchasing decisions, and the lasting impacts of these disruptions as we look into the future and a post-COVID area. So as we begin with our questions, I'd really like to address this, and feel free, either Dr. Spier or Nico, to jump in. What do you see as the biggest bottlenecks or issues for sourcing PPE and medical device at the height of COVID-19?
Yeah, first of all, thank you. I'll take a crack at that, Dr. Spier, unless you want to jump on it first. You tell me.
All yours.
All right. Well, thank you for the invitation to participate in this panel, especially beyond Dr. Spier. I think the world of him and his group. But, that's a great question about bottlenecks. Obviously, it's been an evolution, to put it mildly, since COVID-19 started, of evolution on multiple fronts, including PPE. But at the height of it, and even to today, we all know that PPE was in short supply, but the question is why? Why was it the bottleneck? And if we look at the Hospitals of Providence, and we look at Tenet Healthcare, which is the parent company for the Hospitals of Providence. Tenet's a national company with many, many hospitals in many regions. So I'm going to be speaking today kind of from that context, not just here locally. If I look at Tenet, the issue was raw materials. It was not, it's easy to say we didn't have access to all the N95 masks. It's much more nuanced to say that the suppliers that we had used didn't have access to the raw materials they needed to build those masks. So that's point one. Point two is, for those suppliers, even if they had raw materials, they had a choice to make themselves. Did they want to make an N95 mask or a gown? It costs less to make a gown, and the margins might be higher to make a gown. So they only can make one thing or the other. All else being equal, they chose to make more gowns than masks. So both of those caused bottlenecks that we all experienced here, and we saw in the headlines. At the height, that was the big issue.
Dr. Spier, what are your thoughts?
Well, I mean, I from our standpoint, as medical providers in the community, first and foremost, I'm a urologist. So we're not necessarily in the front lines, but we have 5 clinics. And like was mentioned, we have a great deal of staff and employees that we needed to care for. We partnered with local and national vendors very, very quickly in order to get the proper PPE to our offices. And that took a lot of effort. I think more than anything, it was the panic that was hitting us and our offices and our staff, not knowing what to wear, what to get, the hand sanitizers. But I would say, Nico, first of all, it's a privilege to be sitting on this panel with Nico, incredible community leader, and we owe a debt of gratitude for all of his hard work. So we were really dealing with calming the panic that was going on within our clinics. But the El Paso Medical Society did a great job. The local vendors were incredibly helpful. So we didn't really experience that kind of need for a so-called surge of PPE that was needed from the hospital systems. We took what we could get, but we really practiced more safe protocols was our focus, and figuring out how to protect our patients and staff within the offices. It was definitely a challenge early on, but I don't think we experienced the bottlenecks that maybe the hospital systems did, because we were trying our best to just decrease volume within our clinics. That hospitals had no choice. They were getting inundated.
And if I could add on, Dr. Spier mentioned it, he alluded to the idea of panic, and I'll add on uncertainty. I remember like it was yesterday, it was a night, my wife was maybe in January, she was waking me up and said, hey, look at this story about something going on in China, right? And about this thing called coronavirus. And so I looked at it, and sure enough, 2 weeks later, I was on my first phone call with my leadership team here in the Hospitals of Providence. And the simple question I asked was, do we have N95s? Oh, yeah. We have, tens of thousands. Great. Well, uncertainty and CDC guidelines changed, where eventually we found that, yes, we had tens of thousands, but they were from the previous time there was a fear of a pandemic, H1N1, and those were set to expire. And then you got different guidelines from the CDC on, could you use N95s that had an expiration date coming up, or could you not? That also led to bottlenecks, because we had to err on the side of caution and push those to the side and seek new ones. Now, they change their guidance all the time, but that was also an interesting challenge we had to face.
So I think you're alluding to that next question that we had in terms of just identifying the changes that healthcare providers like yourself, Nico, and Dr. Spier have been making. I mean, from the onset, right? You were talking about ensuring the supply of PPE, and then you had that assurance, but then of course, you know, there was that issue about, you know, well, what's the process if these are expired or not? But are there, aside from just the N95 masks, there's other, you know, medical supplies, devices, services that are needed? How are you all dealing, and how have you dealt with these inventory management, if that's the correct kind of word, inventory management strategies, rather, to ensure that, you know, that you're allocating, you know, the right supplies across the different hospitals that you have?
Go ahead, Nico.
Okay, thank you. So, you know, a lot's changed, and again, I'll speak largely from this perspective of just more than my hospital I'm sitting in. Before this, you know, largely we identified sources for inventory from 1 or 2 vendors, and we drove the best price we could possibly negotiate with them that benefited all parties. This revealed to us that while that's still a very useful strategy, obviously, we had to diversify the number of vendors we have and the geography from which they get their raw materials on locations. So that's been a massive change for us, because before it was all about having the fewer and getting the most out of it. Now we have to have a broad selection across, whether it's gowns, masks, devices. We need to do that. So that's been one change. Another change that we've had, and this is probably much more practical, across all of our hospitals, we've had to standardize as much as we can the best practices for how you actually use PPE. Before COVID, I mean, we all generally follow the same guidelines about how you don and doff PPE, which PPE you use in certain situations. We all had standards, but now we're very meticulous about ensuring that we do implement these best practices across all of our hospitals at the same time, not only because clinically it's best done, but also from a utilization of PPE. You don't want to waste at all, and you can't have waste. So that's really been a source of focus for us, and that's what's changed with regards to inventory management.
And Dr. Spier, as you know, the urology clinics, I know you were talking at the beginning about, you know, the protocols and ensuring that the staff and everyone kind of understood, you know, not just you know, just from hand washing, social distancing, but also ensuring patient safety. Are you seeing now an increased need for PPE? Just as you move forward with opening, and then you're starting to see a larger kind of influx of patients coming in as these months, you know, head into the following year?
You know, I don't want to, like I said about complacency, I don't want to be complacent, but we've really kind of entered into kind of a cruise control mode, where we have stocked enough, we have enough PPE, we have organized weekly visits with all office managers and staff. I mean, these things have really kind of grown organically, you know, and it's actually been a fantastic, I hate to say it, but an exercise for our group. I'm going to change sort of the question just a touch, because for your audience, it's very important that, you know, we've got a lot of audience members that are interested in the medical device field. And I think there's been a big opportunity lost from these companies from a private practice setting, and that is access to the clinics and access to physicians. So we've had to shut down all pharma reps, all medical device reps from coming into the office. What we all have learned is how to log on to Zoom and how to chat on Zoom. I mean, we never ever thought that this would be our new normal. But I think there is an opportunity for medical device companies to do a better job with physician outreach, for physician virtual calls, for educational sessions. That is something that there's a major opportunity for your audience to take advantage of from the physician engagement standpoint. That's been lacking. So I've lost contacts with my reps, you know, but have they reached out and said, look, let's do an educational call? Not really. It's very few and far between. I keep using the word complacent, but there's complacency on both ends. So I think there could be better utilization of virtual calls, education, collaboration. And my other point, it may not be in your questions, Jessica, but it's really important for your audience. I want to make this high yield, and that is, there is going to be a surge of cases. These elective cases are going to come in waves, and Nico's going to be inundated with the Dr. Spiers of the world wanting to post cases. And this is going to affect the medical device companies. So if they're having trouble getting access to the hospitals, in short, I would think Nico would agree, we better be ready for an influx of need because the delayed diagnosis is real. I'm already starting to see it. The cancer cases are going to spike. The patients that are sick, they're going to get sicker because they're scared, and I understand it. But for your audience, there's opportunity now. This is the time to plan.
Yeah, and you bring up a good point. I mean, if anything, we have over 35 medical device companies in the region, you know, that account for more than 45,000 jobs. And so if we want to continue, you know, encouraging the growth of these companies, that's a very important area for them to be able to connect, as you say. And Nico, I don't know if you'd like to touch on that from your standpoint.
No, I mean, a couple of things. So Dr. Spier is precisely right on when we talk about the pent-up demand that exists for clinically necessary surgeries. It is another clinical outcome that's related to COVID, but not necessarily directly connected to COVID. You're going to see a lot of clinical conditions that are worsened because of the delay. And he's absolutely right. The relationships that have been lost or somewhat shuffled around because of COVID with the vendors and whatnot, it's real. Matter of fact, we're dealing with that today with respect to the vaccine. So we're working through our plan with the vaccines. And the question has come up, well, we have a plan for our employees and we have a plan for our surgeons and physicians, but what about the reps? What about the people in the room? Where do they fall in this and how do we prioritize them, given that we have a limited allocation? So it keeps on impacting the people who are listening to this talk.
No, that's a good point. We do have a question from the audience that talked about, you know, in terms of inventory management, do you see COVID-19 affecting the amount of PPE and other supplies that hospitals keep on hand or warehouse locally as safety stock as compared to pre-pandemic levels? Yeah,
so the answer is yes. I wouldn't, sometimes I heard the word stockpiling. I wouldn't call it stockpiling per se, but at a corporate level, at Tenet, there's a massive warehouse that's been acquired for storing PPE that we can use across the country if we need to. It's better use of our resources to do it centrally like that, as opposed to each individual market doing that. We can load balance as a network of hospitals. So that is being done, especially on the PPE side.
What kind of support are you all expecting from the federal government in terms of just assistance, funding, programs, the use of equipment, procurement policies? I mean, there's different types of support, but don't know if Dr. Spier or Nico, if you all could address that.
Dr. Spier?
Well, I wish I could. I mean, we're a private practice independent group. Respectfully, we just don't have access to governmental funds. We rely on day-to-day operations. Of course, the PPP provision, we were on that pretty quickly to survive. We're just like any other business. I mean, I do feel horrible for those of my friends, family that, you know, are suffering. I'm lucky to be able to wake up and come to work, but our volume decreased by about 40 to 50%. We have staff, we have overhead. So the PPP was a gigantic step for us to just maintain operations. But I really can't talk or speak to federal support. Of course, I can speak to Medicare and Medicaid and just insurers trying to support us, but we're really out here kind of just surviving like any other business. I think Nico would probably be better.
Yeah. If we look at the hospitals, like Dr. Spier mentioned, coming up until where we are today, we've had a lot of support from the government on multiple levels across the country for all hospitals, which is great. And I could look at state examples, I could look at federal examples, which is wonderful. However, moving forward to your question, we're not planning for ongoing support from the government. To a certain extent, now we have to make it happen ourselves. So we're planning accordingly, like I mentioned as an example, diversifying our sources of inventory, and also making sure that we can negotiate down a reasonable rate through that diversification. So I talked about that earlier about finding the right dollar amount. Before COVID started, I'd say a fair number was about 40 to 50 cents an N95 mask. At the peak, it was anywhere from $3 to $5 a mask. Now we're back down to about $1 a mask. So through the diversification of suppliers and whatnot, we're getting to where we need to be. And that's not with government support. That's just normal laws of supply and demand that we need to take control of ourselves.
Does Tenet have an active live inventory control process that you're aware of, such as RFID technology for supplies and or equipment?
Here in the hospitals of Providence, we do not use RFID for tracking our inventory. It's a wonderful technology. I can't tell you if there's another Tenet hospital nationally that has it, but I can tell you that systemically Tenet doesn't have RFID as our mechanism for tracking inventory. But we do have very meticulous processes, just not RFID.
And Dr. Spier, across all the different clinics that you have across the region, how do you all track and ensure that you have, the right amounts of supplies and PPE available?
Well, we certainly do not have any sort of nuanced computer programming. It is word of mouth, and it's managerial and team support. And it's a system that I'm very proud of. It was kind of in place, but this has created a ton of synergy amongst the office managers, for example. As I mentioned, it's really just weekly revisiting of current supply and the demands of the different offices, where some offices have to obviously ship out to others in need. So we have an office in Las Cruces as well. So we don't have really a tracking program, and I think it may be in part of the questioning, but our budget, it was hurtful. I mean, we had a probably 8 to 10% increase in our budget for purchasing. We've really had to navigate that financial burden, but it's necessary. But to answer your question, Jessica, we track it per office manager with weekly updates and meetings. It's the best we can do.
Thank you for that. I know we have another question from the audience that I think mentions what other trends, and this is for Tenet Hospitals of Providence, are you seeing at the hospital and or at the clinical level post-COVID? And I know we talked a little bit about that influx.
Yeah, I know. I mean, we see that the focus on PPE is going to continue. So even with the vaccination effort, I think everyone agrees that we're going to be living through this through 2022. But even after that, we believe that there's still going to be a propensity for masks and PPE and sensitivity about any viruses for that matter. I think the level of alert now is heightened across the country, and we're no different here. Interesting, a trend that we're watching, and we actually, for people who have such influence on this call, we're actively participating and applaud the reshoring of manufacturing, particularly to El Paso-Juarez region. We are establishing new relationships with vendors who establish manufacturing sites in North America. It's going to be more reliable for us, including their raw materials. Where do they come from? Ideally, they come from places like Juarez or El Paso, where it's more accessible no matter what happens. So those trends we see continuing. We're going to continue to focus our efforts to build relationships with those companies that do that. It's just to our benefit.
Nico, do you see any other opportunities for startups and innovators to respond, to be able to meet your needs, digital health, at home?
I do. I mean, there's always the challenge you have with startups, and this is getting a little bit aside from PPE and COVID, but a challenge, there's a lot of startups, right? And they're wonderful. They're going to change the nature of healthcare in the future. They always do. But the challenge is when they make the approach, normally they do it at a local hospital level. And the vast majority of hospitals in the country nowadays are part of larger systems. So that's where startups tend to stumble. They hit a brick wall locally. They approach someone like me or Dr. Spier, or let's just say me in this case. They approach me and say, hey, I have this wonderful idea for this new thing, this new widget. Can we try it? Can we use it? And I tell them, sorry, at a local level, I'm not doing that. And I don't know what happens to them. as much as they spend their time focusing on the development of the product, they need to focus on developing relationships at a corporate level with the HCAs, tenants, all acting as well large systems. Develop that competency as well, because that's where the gap is. I'll gladly forward them on to my national counterparts so they can meet them, but then it kind of falls to the wayside. So just a quick thought on the startups.
Yeah, yeah, and Dr. Spier, what can you address as well? Because I know you know, at the onset of the pandemic, you would probably, you know, to ensure the safety of your patients, you were also probably trying to coordinate a lot of these, you know, Zoom calls with patients, and it's slightly different for many and impacting even your staff as well.
Yeah, I mean, I think what I could speak to is just maybe the startups on the telemedicine front, or at least what's happened on telemedicine. We scrambled early on, even with a local vendor here, but it just, you know, it got to the point where there were so many options, and we were able to kind of, you know, essentially shop around and look at things where we picked a couple of different platforms. And so the telemedicine has changed everything. I think we're probably doing about 20% of our practice is telemedicine now. So there remains an incredible opportunity on that front. I think the other opportunity that's out there that needs to be explored is sort of the home visit type of situation where, you know, I think there was a local entrepreneur that has a mobile office that travels to homes. I mean, I think there's incredible opportunity in regards to that. I know, you know, I looked at a company out of Israel that has, you know, basically blood pressure monitoring from home, almost like having an office visit there on telemedicine, where they take their blood pressure, their temperature, everything is delivered to them and mailed to them, so that it's really for more of the primary care doctor. From a urologist standpoint, I don't know what I could develop, but I don't think that it would be very attractive for most people, and obviously hard to gauge from afar with what I do. But you know, I do believe that there are, you know, that there are a ton of opportunities. The challenge here in El Paso, in this region, is and for me specifically in our field, is the aging population, and then just the technical expertise to try to understand how to utilize telemedicine. You know, we have a lot of elderly patients that just don't know how to log on a phone. So that's been a major setback for us on the education piece. And then our clinical research is kind of ground to a halt for the most part. So it's certainly going to pick up, but you know, I'm not really in the front lines with startups, but I am always engaged, and I love that space. Tons of opportunity to continue to enhance the telemedicine experience.
You know, and as we start to, you know, as we conclude, you know, today's panel, I'd like to kind of have both of you, you know, chime in. Nico, if you'd go first on just the lessons learned. You know, I know that we're, you know, focused on this, you know, specific panel on supply chains and how they're impacting, you know, hospital administrations. But from your standpoint, your procurement process, you know, all of that, what have you all been doing along the way to just navigate and ensure that, you know, that you're able to correct and improve?
Yeah. So, I mean, it goes to a lot of what we said about specific to supply chain. You have to be flexible. You have to dynamically change on the fly, and we've had to diversify our vendors, establish new relationships. But on a more broad perspective, our relationship with our vendors and our companies we use is no different than the same challenge we face with our employees, with our physicians, with our community. And unfortunately, it comes down to a very simple thing, and that's trust. This pandemic has tested that simple concept more than anything else in my mind. It's trust. And trust becomes hard when you can't predict what tomorrow is going to bring, because the things you said with certainty today are not certain tomorrow, because guidance changes as you learn on the fly. And so that's no different. So as we work with our companies that provide N95s, that provide gowns, I think it's essential that communication is transparent, that commitments are made and fulfilled, because that trust is all you're going to have. And that seemed no different than me and my staff here. So I know it's more of a broad answer to your question, but really I see that as the most critical piece that I've learned through all of this.
Dr. Spier?
And Jessica, I would say, I like the word transparency. And I would say transparency and communication come to mind when you're trying to communicate with a bunch of staff that are nervous. The lessons I learned was maybe a little bit earlier to come out with all meetings to make sure that everyone's on the same page, because there were a lot of hair on fire moments and confusion on policy and CDC guidelines that made it confusing for some staff and panic, quite frankly.
Yeah.
For this audience, I think, could we have done a lot of things better? But this was historic. I think that what we have to do moving forward is, as I've mentioned, is just look at opportunities and figure out what's around the corner. I agree with Nico in that this is not going anywhere. I mean, it's exciting that we're getting the vaccine. I'm happy to say we're getting one very, very soon. But this is going to be with us for a while. And I think the lessons for me is just we've got to follow the science. And we know that there are different, obviously different views on this. But ultimately, we're just going to have to get through it, and we will.
Yes, I'd like to thank you for your time. I wanted to just reach out to the audience and make sure that if you all have any additional questions or feedback for our panelists, to please submit your questions. I know we're getting to the end of our session, and I wanted to make sure that we were able to address, our audience. I think there is one more question. Beyond PPE and devices, how can we examine our regional healthcare ecosystem to ensure it is as whole and high quality as possible? For example, clinical laboratory reference, laboratory services, radiopharmaceuticals, and has a pandemic influenced our ability to make more decisions locally about the procurement of these services? And that's from Emma Schwartz.
Emma always asking the good questions, right? Dr. Spier, you want to take a crack at any of that?
I've got to read it, I think, or at least summarize it. There's a chat.
Yeah.
I know.
So basically, she's asking, so I've got it. How can we examine our regional healthcare ecosystem to ensure it as a whole and high quality as possible? Well, I think, Emma, in my view, when you in my space, things haven't really changed much. I think that our struggle has become getting, for example, medical supplies and samples of pharmaceuticals into our office. There's got to be improvement with access to our pharma representation, better education on their end as far as what is available and what's not, because ultimately it's affected our patients. For the most part, our cancer care hasn't skipped a beat. We've had to sort of prioritize which patients need to get in, and others basically need to wait until there's the appropriate time. But I think the decisions should be and can be made locally. I think we have to engage with local leaders. This has been a great lesson for me as far as dealing with the Cancer Society, our local health department. We can't rely on our state. We can't rely on our federal government to come through for us. So that's been the big lesson for me, is to grow this, again, like I said, organic, local.
Yeah, and Dr. Spier hit a lot of key points. Only thing I would add is to Emma's question about examining what we can do in a lot of other spaces, like lab, radiopharmaceuticals, to make our system more whole. My job is very simple, and my job is to respond to the needs identified by the medical staff in the community and the physicians in the community. It's not much more complicated than that. So to the extent that we can demonstrate empirically that Dr. Spier and his colleagues For example, they see that there's certain lab services that aren't being done in the community, and we benefit by introducing them. I'm all ears, and we'll help facilitate that introduction. And same goes along any service that exists. So for us, it's not overly complex. We want to listen to the community and provide that supply if there is demand. So that's all we can do right now. And of course, everything's been on pause because of the pandemic, but I'm looking forward to the day that we can focus on those topics in more strength.
Well, thank you all very much for your time today. Thank you to our audience and participants who have joined this morning. I'd like to just offer any last words of wisdom from each of you, any last closing comments. We are very appreciative of your expertise and of your time today. Thank you so much.
Thank you.
Stay safe.
Yeah.
That's my message, and do not be complacent. This is far from over.
Yeah.
Right.
And, you know, a great message. The only thing I would add is, and it's only because I don't get the chance to say it that often, I just hope El Paso takes pride in the healthcare system that exists here. That's Hospitals of Providence, that's UMC, that's HCA. The health system here has done a remarkable job, and I know I'm patting ourselves on the back to a certain extent, but our health system with physicians at the bedside, with staff, have done a remarkable job. So I commend everyone involved during this pandemic.
I agree, Nico. We have healthcare heroes here that across the region are doing some pretty magnificent things, you know, each day and ensuring the health and safety of our community. So I really want to thank you both, and thank you again for participating in today's panel. And we look forward to working with you in 2021 and bringing you back for our next summit, 2021. Thank you all again. We appreciate it.
Paso-Juarez for the invite. An honor.
Thank you again.
Thank you.
Thank you all. Have a good rest of your day.
You too.